if you look at the healthcare sector in China right now, I would say it's probably 10 to 15 years behind where it should be given the advancements that China made in technology.
Okay, so it needs some work and it needs to catch up in terms of the digital revolution here. So arguably more investment into R&D, into digital platforms, and importantly into therapeutics and an effective vaccine as well. Is that part of the narrative in the sector?
Well, I'd like to kind of take a step back here and say basically that there is a uniqueness to the China healthcare system, right? First and foremost, you're going to find that the average Chinese citizen looks for their healthcare at the private sector level, right? So they still don't trust at the public sector level, right? So they still don't trust the private sector, right? And you have a situation where, the tier 1 hospitals that are like in Beijing and Nanjing and other places, right, are severely overwhelmed. They're significantly overwhelmed with people coming from all parts of China, to get the proper treatment, right? So it is a situation basically where they have to solve that problem first before you start talking about, ideas around big data, etc. So the Chinese healthcare system has a very long way to go.
Sam, this is Martin. Let me quickly jump in. So I get the picture you're painting here. Physically, in terms of capacity, basically they need more bricks and mortar, more hospitals, etc. In terms of software and manpower, they need to graduate more doctors, nurses, etc. But, the stuff that knits everything together and which is going to help them make or bridge this gap, because, geographically, the scale of China is just so enormous, is going to be technology. And what I want to know is in terms of AI, all the stuff that they're trying to get ahead in and steal a march over the U.S. on, are they applying that to healthcare that is national healthcare, which the government takes care of?
Nowhere close. And let me just point something out to you, Martin, here. When you mentioned the fact that they need more hospitals, actually they need fewer hospitals, right? The move is towards, treating people in hospitals is very expensive. The move is towards, like you said, using newer technologies, right, in order to see to it that they're able to move people out of hospitals and reduce bed days, right? And that's where the trend is going. And they're nowhere near that, right? The example, for example, if you're treated in a hospital in Beijing, you can go to a second hospital next door and they won't know the data that is stored in the first hospital that you went into. I think the example that you're talking about is where Taiwan is at right now, that have really been able to apply technology in such a way to not only address this, but also were very, very efficient in addressing the COVID-19 issue.